Hi, my name is Jaden Sherman. I'm a paramedic student, and today I'll be teaching you about 3 basic first aid principles. The first principle is going to be splinting, which will be used for a broken leg or arm. The second principle will be the recovery position, which will be used on an unconscious patient. And the third principle will be RICE, which will be used for any stab wounds or deep cuts. Let's start. This is a common scenario that often needs splinting, when you're out and about and you find someone who's injured themselves or broken their leg. I'll be showing you how to splint. When you splint, you stabilize a broken bone, which avoids the person being in any more pain, and while you're waiting for an ambulance. In order to splint, you need 2 pieces of wood and some string to tie down the wood. You get to the injured person, you place the 2 pieces of wood on either side of the injured leg to stabilize the leg like this. You then take your string, which can be a piece of a string, can be a belt, can be a bandage, anything just to tie down the planks of wood. Lift and down, down. When you're done splinting, you want to ask the patient if they are comfortable, as you do not want to cause them any more pain. If the bone is sticking out of the wound, you want to make sure that you bandage it as to avoid infection. This is the second principle of first aid, the recovery position. You can use this position on any of your friends who have had a seizure or have fainted, and this is the safest position to put them in. I will now demonstrate how to put them in this position. If you find your friend in a position like this, take your one hand and put it on his shoulder, the other hand on his knee, and put him on his side like this. Ensure that his left leg is bent in front of him and his right arm is under his head to protect his head. Next, you want to put his left hand in front of him to avoid him from rolling over. The last principle is RICE. RICE stands for rest, ice, compression, and elevation, and is used on a patient who has a deep wound or just a general wound. I'm now going to show you how to perform RICE. For the first part of RICE, rest, get the patient to stop doing what they're doing. If they stop moving, the bleeding can then slow down. For ice, this is used mainly on bruises. If someone has a big bruise, put ice on the wound. Wrap it in a piece of cloth or a t-shirt so that it's not too cold on the actual bruise. For compression, this is with the bleed. Take something like a lappy or a bandage and put pressure on the wound. This will stop the bleeding. I know it seems quite sore, but at the end of the day, if you can stop the bleeding, it may just save their life. And the last thing is elevation. If you can get the stab wound or just the general wound above their heart level, it will slow down the bleeding. Hold up like this, continue to put pressure, and the bleeding should stop after a minute. So to recap, with RICE, rest, make the patient stop moving. Ice, if it's a bruise, put ice on. Compression, if there's a bleed, push pressure on the wound. And for elevation, if you can elevate it above the heart level, do so. Just remember, when working with someone who is bleeding, always make sure that you are safe by wearing gloves. And also make sure that the environment that you are in is safe. You don't want to be the second patient. Thank you so much for watching this video. And remember to be safe, and first aid can save a life.